Basically, I'd just like to get, well, number one, my life back. I feel like it's been taken away from me this year. I've got to the stage that I don't even babysit my grandkids very often anymore because I'm just so worried about the way that I am. I feel like I've let my family down a lot because I haven't been there to do the normal things I used to do. And even just getting back to my activities that I used to enjoy doing, I'd love to get back to that again. So,
hopefully on a journey that's going to enable me to get some quality of life back, and to find some answers, solutions to help me cope with this crippling pain and tiredness and fatigue. And I need to ward off despair. And that's the big thing. I need to ward off depression.
That's been my life for a good while. So I'm willing to try anything to get myself somewhere else.
I'm Dr. Chris Hayes. I'm Director of Hunter Integrated Pain Service. We're a team of people working to help those with chronic pain. We're all based at the John Hunter Hospital. It's an interesting time in pain at the moment because there has been a lot of new science that's come through which has changed our approach to managing pain. So this is one of our challenges as a team, is to communicate this new science which brings some new opportunities in managing pain. We're a group of different people. We have physiotherapists and psychologists, psychiatrists, nurses and pain specialists, all working towards this end. Watching this, you may have been referred to our pain service at HIPS, or you may just have found us on the website. Either way, there is a lot of new information out that can help you to really start your pain journey from today. The way we're thinking about pain, the way we're understanding it, the way we're planning treatment is very different today than it was 5 or 10 years ago. And we've really tried to summarise that for you in this film and on the information that comes with us on the website. So our hope is after you've watched this, you may be able to even start making some changes now. So a little bit about pain and what it is. I would say, in a sense, pain is a signal that something's not right in whatever way. It's a signal that something may be under threat, something maybe in our bodies might be damaged or about to be damaged. It demands that we pay attention to that and not worry about other things. But wrapped around that physical sensation, there can also be an emotional thing as well. So often where there's pain, wrapped around that is this sort of sense of maybe fear or anxiety. Any of these things can be part of the whole mix as well. So it's beyond just a physical sensation in the body. It's more than that. If you look at the different types of pain from our medical classification point of view, it is true that in a way pain can sometimes be an early warning system. So if I touch a hot plate and I'm quick, I might be able to move my hand off the hot plate thanks to the pain system before there's any damage done. It can often be that the pain tells us about some injury to the tissues, perhaps after an operation or a car crash, something like that. It can sometimes tell us that there's been injury to the nerves. Maybe someone has had a leg amputated and they've got pain in the leg that's not there anymore. But often where pain goes on after the initial injury, one of the key aspects is this wind-up or sensitisation in the nervous system. In the past, we've tended to focus more on pain means that something's wrong with the structures of the body. But this newer way of thinking about it and the new science that's coming through says that we need to think a lot about the role of the nervous system. But before that, just a bit of discussion with you about the difference between acute pain and chronic pain. Yeah, medically we would say it's short-term pain is acute pain. So this is what you would normally feel after you fall off your bike, skin your knee, break a bone, have an operation, those sort of things. So the key is the short-acting aspect of that. So the first dot point that it is short-term pain, and often if it is pain that is linked to an operation or a car crash, these sort of examples, it is often the case that the pain is linked to body structures that are either under threat or damaged in some way. I was mentioning before, though, the issue of the emotional component of this. And from this cartoon, it just brings out some of these aspects. But you can see here the little rabbit under threat from the eagle. So there's kind of an emotional or fear factor that is part of the mix, often in acute pain. And then this is the eagle descending and getting his claws into the rabbit, and there is some blood drawn. So there's a mix in this situation of both the emotion around the whole event and physical injury itself. And both often have a role in acute pain, and particularly whether or not acute pain goes on to persist, goes on to chronic pain. Our medical definition at the moment has gone from 12 months to 6 months to 3 months. So medically at the moment we define it as pain that is going on for 3 months or longer. So it can be years, but 3 months is what it needs to be going on past to be defined as chronic pain. And the reason why 3 months is picked out is because after an initial injury and the body goes into a healing phase, often after broken leg, bruising, etc., the tissues are through the healing phase by 3 months. So in other words, if pain goes longer than that, it means something else is going on. You can see what's happening now after that initial injury. Here's the little rabbit with a kite going overhead, and the rabbit is in this sort of super sensitive, hypersensitive, hyper alert state. Doesn't need to be an eagle going over ahead. It can be just something that looks a little like an eagle, and that gets the whole nervous system on edge, the sensitive nervous system. And so that now a little thing, the bite of a flea, it's not meant to hurt very much, but it actually feels like the eagle's claws. So chronic pain, as I say, is pain that goes on for 3 months or more. That is pain that is often persisting after the structures in the body heal, and it's often a lot to do with this sensitisation or wind up in the nervous system. In order to recover from pain, we find it's very helpful if you have a good understanding of what's happening, and really to get to that point of having a peace of mind about what is going on in your body and how it relates to the whole pain experience. Often when pain begins, it can start with an injury to the tissues. Perhaps there's been a fall, some sort of physical injury or trauma. Sometimes there may have been an operation, sometimes an injury to a nerve. But after that initial injury phase, the body normally moves into a recovery or a healing phase. And for most people, that phase sees the pain fade out and resolve altogether. But in some situations, the pain can continue and it goes on to chronic or persistent pain, as we call that. And in this situation, the meaning behind the pain is very different. Often it isn't any longer about the structural damage to the body. These things have healed. So the common message of chronic pain is that it does relate to the nervous system, and the nervous system that is in some ways on edge, and it tells us something about our feeling that the body is still under threat, even though that threat may well have passed. So about 1 in 5 people have chronic pain, which medically we define as pain that goes on for 3 months or more. And of that 1 in 5, 20% of the population, there are 2 groups of people. We find one group are managing that fairly well. They don't have a lot of interference with their way of living, but the other group are more severely affected in the sense that the pain does interfere quite a lot with how they are coping psychologically and how they're actually physically moving through life. Generally, you'll find that there's no magic fix to move from one group that's coping less well to the other group that is coping better. A lot of the medical science says that our traditional treatments, medications, nerve blocks, surgery, aren't that effective, and in themselves they don't help with that transition. What we do know, though, is that even if you are still looking through to look for underlying structural problems, red flags as we call them, and even if you are still going through a phase of some medical treatments, there's nothing to stop you from weaving in the other strategies and broadening out your whole approach to treating pain.
Yeah, because over the years, you present yourself, they say, right, we'll do this, we'll try that. And you know what? It doesn't work for you, and then you feel a failure.
Yeah.
You feel a failure, or you think, oh, it's just in my mind, or it's, am I just looking for attention or whatever? Because everybody sees this lockstep, or in the past it's been this lockstep, and if you don't fit into those steps, well, too bad, there is something wrong with you, go away.
The nervous system has the task of carrying a lot of information to the brain, partly about pain, but partly about many other things. And really it's interesting that until those messages arrive and until the brain makes an interpretation that this is pain, it's not really pain in that sense. It's interesting also there's no one pain centre in the brain. From the research that's been done looking at brain imaging, part of the new science, we see that there are lots of areas of the brain that light up in response to pain. It's not what we may have thought at one stage, that there was one key area. So there are parts of the brain very much linked into the bodily sensations, but these are very much interwoven with parts of the brain that are linked to emotion as well. And some interesting examples to come out of that science show that the way our brains light up in response to a physical pain, if you want to look at it in those ways, can be very similar to the parts that light up if we are excluded from a social group, for example. Still, that sense of emotional suffering is very similar in the way that the brain processes both things. So the new science of pain, looking at what has come out in the research of the last few years, has focused a lot on the whole role of the nervous system. So pain in the knee might not be so much about what's happening in the knee, pain in the back might not be so much about what's happening in the back, but it's the role of the nervous system beyond that. And these are pictures of brain scans, functional MRI scans of the brain, that looks not just at the shape of the brain, but it looks at the way the brain functions. And one of the surprising things to us medically has been that the changes that go on in the brain linked to chronic pain. So we know now that where pain does go on, what happens is that a lot of different areas, you can see the yellow areas up there, a lot of different areas in the brain light up in response to that. And so it fits in with this idea of the nervous system on one hand can be wound up. If it is wound up, just a little bit of input will trigger a lot of pain. So that's the negative side of the story, I suppose. But on the positive side, and this is where we look to treatment-wise, that it is possible to wind the nervous system back down so that levels of pain reduce. So one of the key factors in developing chronic pain is this sensitisation in the nervous system. So it may mean, for example, if you do have a sensitive nervous system, that perhaps just a light touch or perhaps even a change in the air conditioning in the room might trigger a marked response and stir pain up. So that's very much part of the cause or one of the major contributors of chronic pain. And so going on from that to planning treatment, what we aim to do is wind the nervous system back down again with a view to settling, with a view to recovery and dropping levels of pain over time.
Well, I think the first hurdle was to accept that the pain does not come from an active autoimmune disease. The pain does not come from a 20-year-old injury, but it comes from perhaps a hypersensitised system that has spent time battling old injuries and trying to cope with an immune system that is sometimes overactive. But the takeaway I got from it was that whatever's happened in the past has left you with a hypersensitive system, and you're reacting to stimuli that may be very small, and you're interpreting it as something severe. And so I'm reaching for powerful painkillers unnecessarily, and they of themselves are causing me considerable harm.
We know that there is a bottom-up effect to sensitise the nervous system. This is where the arthritis or structural change in the body fits in. But beyond that, the top-down aspect, or the mind-body aspect as we call it, plays a very big role as well. And this is where the nervous system can either be wound up or wound down depending on what is happening in our headspace. So if I have a stressful day at work, that stress can be communicated down to the nervous system, wind it up and increase my pain. On the other hand, if I'm in a peaceful, calm state, then that calm affects the nervous system and can in turn wind down the pain. So that mind-body aspect is a very strong contributor, I think, to the state of the nervous system. There are other factors as well. What we eat is an interesting one. Some foods, if we're eating in a non-balanced way, can sensitise the nervous system and increase pain. On the other hand, if we're eating well, if we're eating a balanced diet and good nutrition, that can play a powerful role to just calm things down. This is over time. We're talking, with all of this theory of the sensitive nervous system, of working perhaps over a few months. It's not the magic fix that a medication might promise, but if people do work consistently with these approaches over a number of months and use the different strategies involved, all of these things can have an effect to calm that nervous system and help people to progress with that recovery phase. So our nervous system is designed to learn patterns from the time we're very little babies or children. We learn new ways of doing things, and as we do that, it's a matter of a pathway being laid down in the nervous system. And really it's the same thing with pain. If we have messages coming from the body that we interpret in a similar way and with similar emotions, maybe similar beliefs about fear or damage, then we lay down a pathway. One of the examples we use often is to say that this is like a sheep track forming across the paddock. If the sheep come the same way across the paddock to get to the dam, then they form this track across the grass. In the nervous system, it's similar. If the messages from, say, a foot that we're registering as painful, the messages come the same way and they're associated with beliefs about harm in the tissues, we can lay down that track in the nervous system that is really very much like the sheep track across the paddock. Then as we move to think about treatment, really looking at that story, it's a matter of spreading the sheep across the whole paddock rather than having them come the same way. This is really a matter of learning new things or doing things in different ways. So in treating pain, it can be important that we begin to think differently, move differently, eat differently, and as that happens, the messages come differently up into the nervous system and the brain interprets things differently. As we do that, we retrain the brain, we deprogram the nervous system, we drop intensity, and recovery happens.
That's what gave me so much hope when you talked about the nervous system being wound up, and you showed a scenario of a lady with fibromyalgia and things that happened and then it got wound up, and then you go along in life and something else happens and it gets wound up.
Yes.
And I thought, that is so true. It is so true.
Yep.
And
Yes.
I feel that, you get to a point where your nervous system, as you were saying before, you get so stressed or anxious, your nervous system gets so keyed up that it's just hard. Everything becomes, intertwined, and you can't see the wood for the trees anymore.
It is interesting that all does interweave, and it is hard to tease that out, which is why I think coming to a group like this, having some discussion through our team, can be helpful to try and figure out, because it isn't just one linear thing, A leads to B leads to C. It doesn't work like that. It all multiple things interweave. The sensitisation in the nervous system message is a more hopeful one, because it does bring in the question, okay, maybe there is a significant contribution from the joint, but hey, maybe there is also a significant contribution from the nervous system. It's pretty hard to change the joint other than with surgery, which can be a possibility at some times, but changing and winding down the nervous system is always a possibility. There's a lot that can be done.